Hello, I'm Dr. Ian Strawford and I'm the Medical Director of the Skin Excellence Clinics. I'm going to talk today about two very popular treatments. One is Profhilo and the other is a more relatively new treatment called Sunekos. I'm going to talk about how we use these treatments and the differences between these treatments because they're both incredibly popular at the moment.
What is the difference between Sunekos and Profhilo?
So both Sunekos and Profhilo contain what's called free chain hyaluronic acid, short and long chain. So just to simplify that, our skin, our tissues produce naturally some hyaluronic acid. And the role of hyaluronic acid is that it supports the cellular environment. It allows fibroblast cells to produce collagen and elastin, but it also helps retain water in the skin, and it helps to give that hydrated, plumped effect of the skin and the tissues beneath the skin. So, they both have this what called free chain hyaluronic acid. And that's different to what people say, well, I've heard of hyaluronic acid, it's a filler. It's not a filler because what we see as a traditional hyaluronic acid filler, where we're looking to create volume and change, then that is where the scientists and the labs have taken free chain hyaluronic acid and they've bonded it together. It's all called cross-linking. So they're creating bigger molecules or bigger particles of hyaluronic acid, all bonded together. And the thicker, the more intense the bonding, the bigger the molecules, the thicker the gel, the heavier the filler, so to speak. So that's the difference between a free chain. And the reason why they make a filler and cross-link it and make all these bonds is so it doesn't get broken down by the body very well. So therefore it lasts. So when we put a filler in, we want it to stay for a good length of time. We don't want it to be broken down by the body if we can help it. So that's the big difference. Whereas free chain hyaluronic acid is being turned over in our body quite significantly, even every day or two. We're producing some new hyaluronic acid in the skin, the tissues. And as we age, our skin and our tissues produces less hyaluronic acid. So that's the problem. So our skin maybe starts to age more, doesn't produce so much collagen elastin, it starts to dehydrate, become less plump, more the aging skin, the dehydrated skin. So by injecting free chain hyaluronic acid into the skin or beneath the skin, we're boosting the levels of hyaluronic acid. The difference between Sunekos and Profhilo is within Sunekos, they've added something very special. They've added a significant number of amino acids, essential amino acids. So we've all heard about amino acids. We may have heard about amino acids. Effectively, amino acids, we have to eat them. We have to source them in our body. We can't make amino acids. Now, amino acids are structural proteins that are needed to make collagen, to make muscle, to make all the structures in our body, the different types of amino acids. So we know that what the skin needs, fibroblast cells, the cells that make collagen and elastin, need a certain number of all of these amino acids. So we're normally sourcing that through our diet. When we eat protein, it gets digested and these amino acids go circulating around the body. We might even be taking a collagen supplement, which are really in vogue at the moment, to get those amino acids in through our diet. With this, we're actually injecting those amino acids. They're in Sunekos. It's the combination of the free chain hyaluronic acid and these essential amino acids. So we're giving the skin, the tissues, those amino acids to work directly to produce that collagen and elastin. However, we now show, and science has told us, and certainly with Sunekos has a huge amount of science behind this product, where they've tested it in laboratories, they've looked at it in universities, and we've got the science that's been all published around how it proves it produces all the different types of collagen and how it works. And these amino acids seem to stabilize the hyaluronic acid, so it stays longer in the tissues. And the longer the hyaluronic acid is in the tissues, the longer it's having that hydrating, plumping effect, the longer it's there to support the collagen production within the tissues. So that's the big difference between Profhilo and is that it lasts longer, and so therefore we get some better results, longer lasting results. And certainly in my experience, Profhilo can work really nicely to give a plumping effect to the skin in younger patients. We're talking maybe 20s, 30s. When you get to your 40s and 50s, it seems to work less and less. And why is that? Because that hyaluronic acid that in Profhilo that we're injecting into the skin, it doesn't stay there. It seems to disappear and then get broken down. So that's, for me, Profhilo is a great product for younger patients. Sunekos is a better product, certainly from an older patient, because it stays there, it regenerates more, it produces collagen elastin, it's been proven to do that, and the benefits and effects of it stay for much longer.
How long do the results last for Profhilo versus Sunekos?
So the results from Profhilo, hydrating the skin, giving it that plumping effect, in a younger patient, we're talking 20s, 30s, maybe even some early 40s, the results, normally you have several sessions injected into the skin, and the results can last, in my experience, between 3 to 6 months. So you've got to keep doing it to maintain those benefits. In older patients, I find that the benefits from Profhilo can sometimes only last a few weeks. So that makes it an unsatisfactory treatment, really, for them. With Sunekos, it's very different. Because the hyaluronic acid, the free-chain hyaluronic acid, stays in the skin for significantly longer than Profhilo, because of these amino acids that are mixed with it, then we see a much longer lasting effect. So in those younger patients, they might have 1 or 2 treatments, or a course of 3, and they may see good results for over a year. And this we also see in older patients. We may see those benefits lasting 6 months, 9 months, or even a year. So we're getting a much better result and a longer lasting result when we're using Sunekos.
Are the treatments painful with either Sunekos or Profhilo?
So both with Sunekos and Profhilo, we're predominantly injecting this product into the skin. Okay, that can be painful, but we use a very powerful topical anesthetic on the skin for about half an hour, and most patients find that the injections into the skin of the Profhilo or the Sunekos are minimal, if no discomfort at all, once we've used the anesthetic.
What is the downtime from either of these products?
So when we're using Profhilo or Sunekos, we're injecting into the skin. We use some anesthetic to make it, comfortable. And so there are little bumps in the skin where that product is initially injected into the skin. In my experience, both with Sunekos and with Profhilo, the little bumps where it's injected will disappear usually within 24 to 48 hours. It's very rare for it to take longer than that. So the skin can look and feel a little bit bumpy for a day or two. Often within 24 hours, the bumps are so small that they're easily covered by makeup and you don't really see them. There could be a little bit of redness from the injections. There could be a tiny bit of bruising from the injections. But again, they're not usually that we see very often when we're using these treatments.
Can these treatments be combined with any other treatment?
So yes, we can combine Profhilo or Sunekos with other treatments, and we often do, because don't forget, these are treatments to help the skin. They're going to plump the skin, they're going to hydrate the skin, they're going to, certainly when it comes to Sunekos, they're going to produce some collagen and elastin, so you're going to get some tightening of the skin and some positive change of the skin. But they're not going to give you volume. They're not going to really lift the tissues in a significant way. So if we're looking to create some more volume, or we're lifting, we might be using a traditional hyaluronic acid filler as well, or we might be using a collagen stimulating filler like a Lanze to get a much longer, more natural result. We might even be treating the skin after we've done these treatments to further stimulate collagen, elastin, tightening and resurfacing. So we might use a resurfacing procedure like a CO2 laser or a Tixel, or we might be using radio frequency or high intensity focused ultrasound to try and tighten the skin more. So yes, they're often used in combination.